Sanbonani, and welcome to yet another episode of She Conquers. Igama lami uPhindile Zwane. And on today's episode, we're going to be revisiting a topic which we've touched on before. This is something which continues to affect many lives of young South Africans.
Nightlife, umuntu ufuna ama one night stand.
The year 2000, we had a small problem then, but it grew quite rapidly.
And she was like, unfortunately, you are HIV positive.
Ongakazi nge-status sakhe makahambe ayo-check.
People don't think they're at risk.
People will talk about you regardless of what's going on in your life.
That's right. Namhlanje sobe sikhuluma nge-HIV and AIDS because it continues to spread. Kodwa-ke, on today's episode, we will be focusing more on the medical treatment and the developments in medicine which have helped people who are HIV positive live longer and fuller lives. As always, we will be talking to some experts on HIV and people who are currently on the treatment to get a better understanding on all of this. But before we do that, asambe estradeni so we can hear what people know about the treatments of HIV and AIDS. Why do you think it's important for us to know our HIV status?
First of all, not to infect others. Yeah, I think that's the most important part.
Ukuthi mawu HIV positive uphuza amaphilisi ngoba HIV ayisabulali manje.
Uphila ufree wazi ukuthi health yakho i-right.
It's better to know than not to know. And then uzokwazi ukucontrola ukuthi uphila kanjani.
If you don't know what's going on with your status, that means definitely you will be playing around without you playing safe.
Because you need to protect your partner. If you're pregnant, you can be able to protect your child. In that way, singa avoid ukuthi abanye abantu babe infected unnecessarily.
With all the information that people have about the HIV and AIDS, there's still quite a lot of stigma and prejudice against abantu ebaphila nge-HIV and AIDS. And unfortunately, this is one of the main reasons as to why people aren't going out to get tested and find out their statuses early. And as we all know, the earlier you know, the better off you are. Okwamanje, sisahamba siya at Kempton Park. We're going to go talk to one of the brightest young minds who advocate for an HIV-free future. Asambe siyambona.
My name is Lebogang Brenda Muzumi. I am from Parktown, Johannesburg. I grew up in a place called Linden, not far from Cresta. My mom's a domestic worker, so I grew up in the back rooms of the big houses type of thing, you know. It was great. I can't say it was a train smash, you know.
What type of girl were you growing up? Were you like shy?
I was very shy, funny enough. I was shy, I was big in terms of my body weight, and that made me very insecure. The girls would get love letters, and I don't get love letters, Khanti. What kind of person am I?
So growing up, were you guys very open? Were you able to have like open conversations with your parents and your sisters, considering the fact that you guys were close?
There was no such. There was no such. It was stay away from boys. I remember when I got my first menstrual cycle, my mom was like, if you're gonna stand around boys, this blood is going to come flowing, so stay away. You know, and me being me, I stand next to boys, there's no blood flowing.
You're trying to test it, like,
I'm trying to test this thing, you know.
So growing up, what were the conversations had in Lini around HIV and AIDS?
There were conversations, but it was never normalized or serious conversation. It was like, oh, there's HIV out there. And we would, of course, because at 3, you know, and you would see people, oh, they're losing weight, oh my God.
It was
those conversations. It was the stigma. It's not for me, but it's for them.
And then how did you find out about your HIV status?
So there were rumors. So now I had moved to Parktown, and then I met the certain guy that I was dating at the time. My friends were kind of telling him, watch out. Because the person I dated who passed away from the virus was kind of well known. He passed away and he was very ill when he passed away. So there was the assumption Lebu was with this person. Clearly she's also infected, you know. And he came and we tested and we waited. And they put us in this room, you know. And the lady was like, I don't even know why she said this. I'm kind of against it now. She's like, oh, Obuti Ushapo. meaning I was wrong, clearly. But all right. And she was like, unfortunately, you are HIV positive. A lot of emotions came rushing, right? There was denial, there was shame, there was what have I done? I'm going to die, like tomorrow type of thing. I stopped doing a lot of things because I thought if I live right, then God will award me and heal me, you know? And then I was also told that the ARVs are the ones who make you sick also, you know? You must stop. That was a journey of 6 months being in and out of hospital. I think the longest was maybe 3 months, not going anywhere really. I was up and down different hospitals. At some point I was told go to hospice because I had gotten to a point where I had abdominal TB, I had pneumonia, I couldn't walk at some point. But I did research and I started learning about my medication. I started hearing other people's stories and researching other people's stories, and slowly but surely I gained my health back. It wasn't an easy journey. It's still a journey to date, you know, and I think with treatment it's things that I struggle with to date.
So now, what is your outlook on life and your goals, even after the whole experience?
You know, I've been on my deathbed twice. I think through that I have found my why in life. And my why in life is fighting stigma and discrimination. It's educating, it's revoking, or rather reinstilling hope for those who have lost hope, you know, and saying I'm living with HIV, so what, type of thing, you know. There is more to me than my HIV.
So what advice do you have for people who are living in the fear and the denial of HIV, what you went through?
I think the best way to beat your enemy is to know about your enemy. And understanding that people will talk about you regardless of what's going on in your life. It's not easy. I know there are people who hide medication. I know there are people who put medication in different containers, you know, hiding it because of whatever judgment and stigma they will get from the family. But when you get to a point of self-recognition and saying, my health comes first, any other barrier is not going to affect you.
Lebu, thank you so much for being here with us today and sharing your story, and good luck to all of your future plans and your goals and aspirations. Thank you so much.
Thank you very much
I
for
think I need
having
a hug. I need some love. Lebu was such a breath of fresh air. I really liked her positivity and her outlook on life, and it's good to know that there are people like her who are out there to inspire and motivate people about getting tested and sticking to their treatment. Right now, we're going to an ad break. See you just now. Welcome back. If you just joined us, sisakhuluma nge-treatment ye-HIV and AIDS. Right now, siyahamba siyethembisa siyokhuluma noNandipha who's about to share with us her story. Asambeni.
Okay, igama lami nguNandipha ngokwamya. Ngisuka e-Eastern Cape. Okwangondihlala apha eJozi eThembisa eMadela. Impilo yami bengiphila e-Eastern Cape. Bengingaso impilo right. To be honest, because bengahlali nomama. Bengihlala nomfazi kaBhutaki. So bekuyimpilo nje yokuthi noma wenza something uhlala uthukile ukuthi bazokushaya. Iyo into yenze ukuthi ngize ngibuye ke ngizohlala la.
Alright, bese musohlala lana, musohlala nomama.
That time ngifika la bekasahlala emakhishini, sebenza emakhishini. Bengihlala nje nabawomakhelwane. Monday to Friday mama ngimbone ngama weekend. But manje ke sengihlala naye everyday ngiyambona akasasebenzeki like akasasebenza sleep in. Yeah.
Manje sisinandipha into eyenza ukuthi ufuna ukutesta.
Into eyenza ukuthi ngifuna ukutesta angeke ngisho ukuthi into ngangibone nje labantu laba ba testayo laba bama-10 ngabona ukuthi awuthi nami ngeke ngingene umuntu akazibheke yabo ya ngaba ngiyangena lapho ngafound out kanjani.
And then uthe ufile ngathi bungabelieve.
Bengabelieve futhi ukuthi like kuso kwenzakala kanje azange ngibelieve. That time ngicheck 2013 azange ngikhulume nomuntu ngayenza yaba imfihlo yami. Ngaba nobhuti wangitshela yena ukuthi unjalo like mangimuzwa akhuluma ngabona ukuthi lana mose impilo ikhona waye umuntu kwamele ukuthi afihle yeah but amalo kwakhuluma njanga namahloni ayikhulumela nje ukuthi hayi uso ngami
yeah manje ngasikhathi uso-founder thile kodwa ungatshela umuntu uthulile ngalento leyo bo uhamba ama-treatment or bo umuntu usaba nje ungafuni ukwazi lutho
bengafuni ukwazi lutho bengumuntu nje bekasaba bengingenzi nix
indaba
angazi nami maybe bekuwukuthi bengisasemncane maybe benginabo ma 15 16 somewhere lapho bengithukile like ucabanga ukuthi ngizothi mangitshela ifamily yami yo bazongishaya ekhaya bazobe bangibuza imibuzo eminingi yeah
also masoqeda ukukhuluma nobhuti yila ubona kahle ukuthi yazi ngithi understand le ndaba lena why you researcher
researcher nasezikolweni yazi ukuthi kuyafundiswa bakutshele nakulama amanye ama-organization lokho kufika abantu bakufundise yabona leyo nto manje uyithathe wena uyibeke la kuwe
and then masoqala ku-treatment yena usitshele ukuthi i-treatment phase yakhona benjani
treatment yami ngiyiqale last year ngoMay
yinto eyenza ukuthi ufuna uqala i-treatment ngoba njengoba ushilo ufana nathi ngo-2013 but you only started last year nge-treatment
into eyenza ukuthi ngifuna ukuqala i-treatment ngeke ngagula last year ngaya eclinic mangifike eclinic bangirana ama-test yazi-ke mawusose-clinic akhoda lapho lokuthi ungathi ngiyabaleka bavele bakutshela ukuthi sokunje manje sithatha i-CD4 count yakho uzobuya uzoqala i-treatment
so masokuqala-ke nge-treatment yini information ebakunike yona khona esibhedlela or eclinic bakutshela ukuthi kumele uphile impilo yakho kangayo
eclinic bangitshela ukuthi kufuneka ngithathe i-treatment yami same time every day ngidle before ngithathe i-treatment yami ngimake sure ukuthi izinto bengizenza like i-alcohol ngiyayireducer angiyiphuzi benginobhuti bekayidla le treatment la ayiyeka khona wavele wagula enye into engasukumi naphansi kumanje last November uyewashiya emhlabeni just because ukuthi i-treatment yakho uyewayekela phakathi
sure so i-treatment into important kumele uhlezi uyithatha same time every day
important kakhulu ukuthi uhlezi uyithatha noma ngabe uya kuphi ihlezi bese esikhwameni sakho nje ongakazi nge-status sakhe makahambe ayocheck kubalulekile ukuthi uhlale uzazi ukuthi ume kuphi ungaziboni so uvele nje sowuxake abantu endlini kungcono usakhona ukuyisukumela uzihambela ngeenyawo zakho uyochecka usazi i-status sakho and usi-accept
siyabonga kakhulu
bonga mina
What a great conversation that we just had on Andipa. It's so unfortunate to find out that even till this day, people still feel like they have nowhere to turn to after finding out about their HIV status. But I like the advice that she gave us about even when you find out about your status, impilo iyaqhubekela phambili as long as you're still taking your treatment. Okwamanje siyahamba sokhuluma ne-expert ezosinika information about the evolution of HIV treatment. Asavele.
So my name is Professor Francois Fenta. I work at Wits University as a researcher doctor. I work for the Wits Reproductive Health and HIV Institute, which looks at public sector access to antiretrovirals, to HIV testing, HIV prevention, all the stuff around HIV. So I'm often asked how bad the infection rates are in South Africa. It's come down fairly dramatically in the last 5 years. In fact, we're almost half the number of infections that we had 5 years ago. From 1,500 infections every day to somewhere between 500 and 800. So 500,000 South Africans being infected every year, down to less than 300,000, probably close to 200,000 in fact. And the reasons for that are complicated. It's a conglomeration of antiretrovirals. When we put people on treatment, they stop transmitting the virus. There's also significant government investment in prevention, such as HIV, sexual behavior change programs, condoms, male circumcision. All of those things together, I think, have meant that we're seeing a fairly dramatic drop in numbers. Having said that, it is off a very high base, so it's still a lot of people being infected every day. So I'm often asked again, why do we have this ongoing epidemic? If we have all these amazing prevention and treatment options, why are people still continuing to get HIV? And again, it's a complex human behavior question around people having sex, essentially. And I think partly we don't have enough prevention options for people. Partly people don't think they're at risk. It's a complex illness, it's transmitted in complex ways. We need to keep our eyes on it to ensure that we don't get complacent. We've made this incredible step forward and we need to make sure that we milk that for as much as we can. So HIV treatment's been a bit of a revolution, and a good revolution, because it's gone from a situation where we had nothing to offer people other than treating the infections, and people everybody died. It was horrible. And this is 15, 16 years ago in the state sector, and even in the private sector in South Africa, most people died. Now, what happened is we had early generations of antiretrovirals, which were pretty toxic, and multiple tablets, taking them in the morning, taking them at night. If you forgot more than a dose or two a week, you got resistance. We've slowly moved to a situation where the tablets were all combined in one tablet once a day, which is about 2010. The next future is going to be depot, where we're going to give you an injection once a year, and you won't even have to think about it. It'll just take care of itself. I think probably one of the most incredibly empowering thing you can do is go and get yourself an HIV test, and understand that if you're negative, you understand you're negative, you can take steps to remain negative. If you're positive, we have a treatment option for you, which is actually really easy to get on and is got relatively few side effects, and returns you back to normal life. Your sex life's back to normal, your employment life's back to normal, your sports life is back to normal, everything is back to normal. You take your tablet every day, you're back to normal. And I think that for me, getting yourself tested just makes so much sense. Rather, return yourself back to normal.
Those were some eye-opening conversations which are very important to be had now. And I can only hope you got to learn as much as I did from them. We're about to go to an ad break. See you after this. Do you think we can live in an HIV-free generation?
It is possible.
Ho ya ka nna e ka se fele. Batjha ba na le tokoloho e senang responsibility. Ba active too much for sex.
Nightlife. Umuntu ufuna ama one night stand, you know.
I believe so. If we still believe in God, if we just believe in God, that maybe He can be able to heal us and take this devil away.
That will never happen. Due to the fact that from a young age of 12 years old, people get encountered into sex. I don't think it's going to stop, man. Like, people are not following procedures.
Yes, if we can be in more education about HIV and AIDS, then how to prevent it.
It is possible because most of the people are on treatment and awareness is everywhere.
My name is Dr. Yogan Pillay. I'm a Deputy Director General in the National Department of Health, and my responsibilities are all of the communicable disease programs as well as the non-communicable disease programs. And this includes HIV as well as the TB program, together with maternal and child health programs and a range of other programs. So South Africa has a huge HIV burden. Currently it's estimated that about 7.8 million South Africans are HIV positive. So if you go back to 2000, the year 2000, we had a smaller problem then. We had a problem, but it was much smaller, but it grew quite rapidly. It's largely because we were not focusing on prevention as much as we should have, as well as treatment of those who had already contracted HIV. So starting in 2009, 2010, we did a number of things to ramp up our interventions, our activities, to prevent new infections and also to get large numbers of people on treatment. So if you look at the numbers in 2009, there were about 400,000 patients on treatment for HIV in 2009. And if you look now, in 2017, 2018, we now have reached over 4.2 million people on antiretroviral treatment. And we have, again, a large number of interventions focusing on prevention. So, for example, we buy about 900 million male condoms and about 40 million female condoms. We also have a huge voluntary medical male circumcision program. Currently, over 3 million South African men have been circumcised because we know that that prevents HIV acquisition by men as well. We also have a very good prevention of mother-to-child transmission program. So we have a number of programs that have been very successful in also preventing HIV transmission. We would like to have an additional 2 million people on treatment, which will bring our numbers up to more than 6 million people on treatment by December 2020. Now, one of the ways to prevent people from getting infected after having unprotected sex, and sometimes it's not having unprotected sex, but condoms we know also do fail, they do burst, etc., is to provide patients or people with post-exposure prophylaxis, or PEP. And we've had this now for a long time. And the idea there is that people who have had unprotected sex or where the condom, for example, bursts, they can come to our facilities and ask for post-exposure prophylaxis. And then, of course, we have also PrEP, which is pre-exposure prophylaxis. And this is a fairly new intervention, again, to prevent transmission of HIV. And it's being used as a way of ensuring that people take a tablet before they have unprotected sex to prevent them from acquiring HIV. And they have to take it for 7 days and build up the amount of the medicine in the body so that the medicine can be effective. You can't take it today and have unprotected sex tonight. It doesn't work like that. So one of the challenges is knowing your status. You can't seek treatment without knowing you're HIV positive. And many people have a risk perception that is at odds with their actual behavior. So people who act recklessly oftentimes don't think that they are candidates for HIV transmission because of the risk perception. So there's a new global movement, and also in South Africa, that we should be taking our services to people where they are. So if people are in clubs, social clubs, we should go there. People are in homes, we should go there. People are in factories, we should go to factories. If people are out in the streets, in shebeens, that's where we should go. So the idea is to go take our services, health services, whether they're prevention, promotion, or treatment services, as far as we can to where people are.
Well, like our president said, we should not get used to the idea that we are going to live with HIV and AIDS forever. And according to Francois, an HIV-free future is possible. But it takes each and every single one of us being responsible with each other and staying informed, because njengoba sisho la eMzansi, umuntu ngumuntu ngabantu. Well, it's been an amazing day talking to some amazing people, and all I can say is, Muntomusha, take care of yourself. To be a part of the conversation, please visit our website on www.sheconquerssa.co.za or visit any of our various social media pages. Thank you for watching today's episode. Igama lami uPhindile Zwane. See you again soon.